Can a serious shoulder injury qualify you for Social Security disability benefits? Potentially, yes. But Social Security isn't simply looking for a diagnosis or an MRI showing that something is wrong with your shoulder. The bigger question is whether your medical condition prevents you from performing substantial work on a sustained basis. Shoulder problems can take many forms, including rotator cuff tears, severe arthritis, labral injuries, frozen shoulder, chronic instability, nerve involvement, or ongoing limitations following surgery. Some people experience persistent pain, weakness, reduced range of motion, or difficulty using one arm even after extensive treatment. Those limitations can have a major impact on your ability to work. Think about what you actually have to do during a normal workday. Can you lift and carry objects repeatedly? Can you reach overhead? Can you reach forward or away from your body? What about pushing, pulling, handling objects, or using your arm repeatedly for several hours? For someone whose career involved construction, warehouse work, manufacturing, maintenance, delivery work, or another physically demanding occupation, serious shoulder limitations may make returning to the previous job extremely difficult. But Social Security doesn't necessarily stop there. If you cannot perform your past work, it may also consider whether you can adjust to other work based on your remaining functional capacity and vocational factors such as your age, education, and work experience. That's why good medical documentation can be so important. Social Security may review orthopedic examinations, MRIs, or other imaging, surgical records, physical therapy notes, injections, medications, and findings concerning strength and range of motion. Objective medical evidence must establish a medically determinable impairment, and Social Security can then evaluate symptoms such as pain and how they affect your ability to function. You also don't necessarily have to meet one of Social Security's medical listings to receive SSDI. If your condition doesn't meet or medically equal a listing, Social Security generally assesses your residual functional capacity or what you're still able to do despite your limitations and uses that assessment in deciding whether you can perform your previous work or other substantial work. Duration matters as well. Social Security's definition generally requires that the impairment prevent substantial gainful activity and have lasted or be expected to last for at least 12 continuous months. At Disability Advocates Group, we help SSDI claimants nationwide with every step of the application and appeals process. If your shoulder problems or a combination of shoulder problems and other medical conditions are preventing you from working, call Disability Advocates Group at 800-788-2095 for a free consultation. You can also use the free SSDI screener at ssdianswers.com to see if you may qualify for benefits. This video provides general information about SSDI. It does not constitute legal advice.